pressure topic we're covering today does not replace your official consultation with your own physician. It's for general education and general awareness of what blood pressure is. So me being here does not substitute your doctor's advice. So this is what we're going to cover today. So that gives you a scope of things, what we're going to be doing. We're going to define what blood pressure, high blood pressure is, how to diagnose, what are the risk factors. If you have high blood pressure, can you get symptoms? We're going to touch on that. What are the various treatment options? And then in summary, what to take home from this talk if you have high blood pressure or your loved one has high blood pressure. So the definitions of high blood pressure keep changing every decade as American Heart Association and other bodies which give recommendations for definition of high blood pressure want to catch it early. And the reason being, if it's not caught early, then damage the organs. We will talk in a minute. The complication of high blood pressure get permanent. So it's good to catch it early and get the awareness. So if your numbers are above 130 or 80, the top number, then you have stage 1 high blood pressure. If it's above 140, then it's stage 2. So ideally, we want to keep the number around 120 or 80 if we can. A lot of time, I have patients and I've been in practice in medicine for almost 30 years in Pinellas County. I have probably thousands of patients on high blood pressure medications, and a lot of them don't take the medications because the medications sometimes cause side effects. So I tell my patients, yes, high blood pressure is an important condition to take care of, but I don't want you to suffer the side effects of the blood pressure medications either. So a lot of time, they just develop a cough from, let's say, lisinopril or something like that, and they stop taking their blood pressure medication until they come for the next annual wellness, and it's a year later. So we talked about two numbers. We said we want to be 120 over 80 or less. So what are those two numbers? So the top number is called systolic, the bottom number is called diastolic. You don't need to remember the names of those, but what it means is when the heart pumps, the first kick hits the artery, and that's the systolic. When the heart rests, the gap in between is what captures the bottom number. Both numbers have significance. Both numbers by themselves can put you in high blood pressure categories. So, two big categories of high blood pressure. One is primary, which is most of you folks here. And the secondary, I'll go over that in a minute. The primary, we don't know why. Most of them will go over the risk factors. It could be genetics, that your parents have high blood pressure, your siblings have high blood pressure. So that can go down. And then if you have it in your family, then be hyper aware. And every time you come to YMCA, I know they have blood pressure cuff or not, but Publix has it, a lot of pharmacies have it. Just put your hand up there, check your pressure. And if you go to the doctor's office for some other reason, make sure they check your pressure because it can slowly increase. So if you have good numbers last year, does not mean you will stay good next year or so. So we talked about mostly it's silent, but if your pressure is 180 systolic, 160, 170, 200, those are the time when you can get some of these symptoms. Not always. Some people are very tuned to their bodies and they get pressure in the neck, throbbing sensation, nausea, dizziness, chest tightness. So look at the amount of people who get high blood pressure throughout the world, 1.28 billion people. So it's a big issue. 1.31 billion is spent in this country every year on high blood pressure treatment. About 3 million people are newly diagnosed in this country with high blood pressure. So it's very common. And these are the risk factors. We talked a little bit about age. Come on. Genetics, we talk about if you have family history, mom, dad, brother, sisters. Genetics, we talk about if you have family history, mom, dad, brother, sisters. Being, if your base circumstance is bigger than it should be, if you're consuming too much salt in your diet. A lot of patients, I ask them, do you consume too much salt? I said, no. I said, what do you have for breakfast? Pizza. So, any processed food, it tastes good because it has 3 ingredients. One is salt, one is fat, one is sugar. So, it's a lifestyle disease. So what I mean by that is, if you change your lifestyle, you can make a dramatic difference in where your pressure is. So there are a lot of risk factors which you can change, which are modifiable risk factors. And some you can't change if you're, genetics, or if you're born with congenital heart disease where the arteries are tight, you can't do anything about it. But a lot of things you can do which will lower your pressure and reduce the need of the medications. So what can you do? Number one, get a little bit more active than where you are. So most of these folks coming to YMCA and teaching the choir, most of you guys are active, but if you're not, get a little bit more active than what you are. So most of the things we covered with smoking, we didn't talk about managing stress. I think that's very important in this day and age. We are so stressed as a society, whether our kids are not behaving, or they're getting divorced, or you're getting divorced, or you're moving. There's so much stress. Hurricane is coming. Just day-to-day living is stressful. Financial stress, cost of living going up, and your income is not there. So managing the stress does help lower your pressure. You can't increase your income, but at least you can say it is what it is, I got to live with it. So if you get acceptance in your mind, whichever way you can do that, whether it's having more social interaction, hobbies, yoga, tai chi, meditation, religious activity, prayer, and walking. Walking in nature has been shown over and over again. We're blessed with beautiful beaches here. You go out and walk for 30 minutes. So the dash diet is what I was alluding to. On the left column, you should eat more. On the right column, you should eat less. So it's primarily whole grains, fruits and veggies, olive oil, fish, poultry, but lean poultry, and a lot of beans. Beans are superfood. They help you stay full. They give you protein, but please don't use canned beans. Canned beans full of salt. Use the dry beans, soak them overnight, make a chili, add some brown rice, you got a beautiful meal. Add some salad, you get a full whole day. Try that. Try apple. Try pear with skin. Always eat the fruits washed but with skin, because that will keep you full, get you the magical component of the fruits and veggies, which is fiber. Fiber is what keeps you full. Fiber is what feeds the microbiome in your gut. So we talked about DASH diet, limiting alcohol, more physical activity, and then healthy weight. So if you can even lose 5 pounds in the next 3 months, I'll be happy. I'm just not asking for a moon, I'm just saying 5 pounds less in the next 3 months. Small goals, you don't get overwhelmed. You say, oh gee, I'm gonna look like Cindy Crawford in 3 months. Sure, you can go to see a plastic surgeon and then, they can do the magic, but it won't make you healthy. But if let's say your BMI is 35, you say, that's a lost cause. What 5 pounds will do? 5 pounds will, even a BMI of 35, will reduce your risk of heart attack, strokes, and high blood pressure for the next 1 year. Just 5 pound weight loss. So don't get overwhelmed. Just have small goals. 1 pound a month is 12 pounds a year. I'm happy with that. All right. So medications. I'll be quick because there's so many of those, and if you have medication-related questions, hold on to that, because the common category is the lisinopril, the quinapril of the world, which is called ACE inhibitor, The second common category is receptor blockers, which is like losartan, valsartan, Divan. And then calcium channel blocker is the third common category, like the TSM or verapamil or nifedipine and lodipine. A lot of you folks on that. Diuretics is another common category, spironolactone, chlorothalidone, and CTZ. And the beta blocker is also another common category, like metoprolol, toprol. So, in summary, it's never too late. You know, I have patients with pressures of 180, 190, and they are on 4 medications. They are special. You know, you got to work with them and see what's the limiting factor. Are they really taking their medications?